For the first 7 weeks, I was basically incontinent. A lot of the time, I wore a big pad, and after that, it has gotten better, but it took much longer than I thought it would.
Side effects are the result of the prostate's proximity to other tissues. As medical techniques are refined and improved, the risk of adverse effects is being reduced.
The main risks with radical prostatectomy include urinary incontinence or leakage of urine. This is also a possibility after brachytherapy and external beam radiation, although generally speaking the risk is much lower with external beam radiation and intermediate for that of brachytherapy when you compare it to the other two treatments.
Incontinence can occur after cryosurgery, but the risk is very low. Approximately 5% of men may develop mild stress incontinence, and approximately 5% of men may develop mild urgency incontinence. Total incontinence is exceptionally rare.
Brachytherapy and external beam radiation can also be associated with what we refer to as chronic irritative effects on the bladder and the urethra, meaning that the person treated can have difficulties with emptying their bladder on an ongoing basis. The risk of rectal complications is probably higher with external beam radiation and very low with radical prostatectomy and brachytherapy.
Kegel exercises to strengthen the urinary sphincters can help, but a man who's still having urine control problems a year after surgery should talk to his urologist about treatments. Another issue to discuss with the doctor is how your cancer treatment may affect your sex life.
The risk of a man losing the erections is higher within the first few years after treatment with prostatectomy than with the other radiation treatments. However, this risk actually approaches each other, particularly with brachytherapy and prostatectomy, at about 3 to 5 years after treatment.
I certainly have memories of having a very enjoyable sex life before the prostatectomy. Now, you may have...
No, I have no complaints.
Oh, good. They came later. So
that was the hard thing, was losing it at such an early age. That was the part that you do feel a little gypped by.
Well, yeah, that was certainly a problem to be.
But it certainly beats the alternative, and I'd rather have you here.
The threat of cancer forces most people into a place where they don't feel very sexual for a while. However, intimacy and love and tenderness are important pieces in most relationships. For men, sex is very much a part of that. So many men fear that they're going to lose their ability to be tender and intimate when they lose their ability to have an erection.
Sometimes a little hug and a cuddle will get past a lot of other problems. Sometimes it doesn't, but you know, there's the frustrations of losing that male aggressiveness, if you will, or the being able to perform on demand. That is certainly not there today.
There are many options available to help men regain their ability to have intercourse. Medications are the most common, but for men who can't tolerate these, other alternatives are mechanical pumps and penile injections. Some kinds of hormone therapy also affect a man's ability to achieve an erection or even to experience sexual desire. In order to stop feeding the cancer, this treatment suppresses the production of testosterone, the main male hormone. This essentially puts the man into a state much like a woman's menopause.
We're all very different. The only side effects that I have are hot flashes.
I used to call the hot flushes of barn burners because they just about felt like you were on fire.
But tiredness is another one, and loss of memory.
Well, I didn't go through the mood swings. I did the memory loss. And it was most irritating. I've been doing crossword puzzles since I'm 11 years old. And for the first time in years, I have to reach for the dictionary.
Normally, after you stop hormone therapy, it takes 6 months to a year to get recovery of testosterone, so that you're looking at a 2-year interval, usually about a year on hormones and then a year to recover testosterone and normal function.
Regardless of what treatment you have, your PSA will continue to be monitored to watch for any recurrence of cancer.
If you've been diagnosed with prostate cancer, the most important thing to remember is that this is probably one of the most curable cancers we treat. One of the problems with all cancer work is fear, and you can overcome that by understanding the process. We have very good cure rates for surgery, radiation. In low-risk disease, you can expect 90% cure rates. And even in high-risk disease, with the appropriate treatments, we can expect very high cure rates of the order of 80%.
The most important thing every man needs to do when they have prostate cancer is to ask for help. The hardest thing sometimes for men to do is to ask for help.
I did shortchange Lorraine by not going to the support groups. I have this, what I call terminal illness of the John Wayne syndrome. I didn't need that. And
but it's
in the early part, I really didn't need it. I felt quite comfortable with where I was at. I was lucky. I was able to make the right decision. I got the right information, and it has worked for me in this journey. But had I realized, and I didn't realize how much my partner was hurting. That was a real oversight on my part.
Increasingly, men with prostate cancer and their families are turning to each other for support and information.
What men need most is the support of their family. They need some good information. They need to meet other people that have the same disease. Even at the earliest stages, if a man's been diagnosed with cancer, he truly feels that he may not live very long or the cancer is going to get him. To be able to meet people in the same boat that he is and to be able to talk with them and to take his wife there and the family there is so wonderful, and you feel so good and relieved afterwards.
I just think that we've built this group on family, and knowing that everyone is so important in this disease, or any disease for that matter, that the family is so involved and so intricate in staying well,
yeah,
and having a quality life. And I think we all have to remember that you never walk alone.
That's right. That's right.
You just never.
I think
walk
that's a great
alone.
statement, Jen. We never walk alone.
Yeah.